Welcome back. Beginning July 1st, and that's coming up here real soon, Aetna will no longer offer Aetna Advantage plans for individuals, families, and the self-employed in California. With us this morning is Craig Gusson. He's the health insurance broker, and he's here to kind of share and tell us why, talk about the Aetna situation and a few other things. Good morning to you.
Good morning.
Now, we are just talking about the individual plans
Correct.
and the self-employed here. So those with a company plan, don't worry about this at this juncture, right?
Exactly. It's just individual plans. Aetna made a business decision that they're not going to write individual business in California after January 1st. So what they did is they decided they were going to stop writing individual plans as of July 1. People who have individual Aetna plans can keep it through December 31st. And January 1st, they'll be able to go into one of the other plans that are guaranteed issue.
Now, you sell these plans.
Yes, I do.
You said Aetna really doesn't have that much of a stronghold individual plans here in the state of California.
Correct. They don't. I think the numbers I saw, they had like 84,000 insured in California. And they just made a business decision that it just wasn't right for them. We have a lot of competition in California for individual plans. So they just made that decision. It makes sense to me.
Just wasn't cost effective for Aetna to continue to do that. Will there be other programs like Aetna or other companies that will pull out, or are we pretty much set?
I think we're pretty much set. Everybody else that sells individual coverage is going to stay in it. Most of them are in the exchange. So, yeah, I don't really see any other surprises.
All right, let's talk about the individual plan. We're going to leave company plans for another day. There's so much to talk about here with this healthcare plan. There are some essential benefits that you have to have coming effective 2014, right?
Yes, there's 10 of them. The big ones are that every plan has to have maternity coverage and newborn care. Everyone has to cover hospitalizations. Everyone has to cover an outpatient surgery, out services, outpatient services. Everyone has to cover prescriptions. Emergency room, the very basics, mental health, rehabilitation, preventative. And one of the things a lot of people don't know is that part of the health care reform law is that kids are covered for vision and dental until they're age 19 as preventative. So that's one of the things also that you want to be aware of. And every plan in the United States has to have this. Regardless if it's a group or individual, they all have it. And it's really important to know. The other big deal is that if you go into a plan in the exchange, instead of being able to continue seeing your doctor, and maybe 95% of the doctors right now are in a PPO plan, you may only be able to see 35% because they've gone to what they call a narrow network to keep the cost down. And it's a big concern that I have because you may go and pick a plan and think that, okay, my doctor takes this and find out that he or she doesn't take it because they really narrow the network down to maybe 35% of all the doctors in San Diego County.
We've got to go, but what's the best source? What's the best source? If an individual's out there is just confused by what they need to do come 2014, what's the best source to go to
The best thing to do is reach out to your insurance agent who specializes in health insurance. The San Diego Association of Health Underwriters, most health insurance agents belong to that. And they can help you and educate you because I've spent a year and a half trying to understand this and I'm still not done.
All right.
So there's a lot to know. Things are changing every day. So until September, we still are seeing changes.
Can we keep you coming back and educating us as we go along? All right, Craig. Thank you very much.
My pleasure.
We appreciate it.